How do you assess frailty in ICU? Frailty is a dynamic process. Therefore, multiple reassessments should be done in ICU to adopt the care plans according to the changing conditions of the patient. The assessment of frailty is multidimensional. History, examination, frailty scores, cognitive assessment, biochemical assessment, and multidisciplinary assessment are the basis. History of fatigue or exhaustion, pre-existing medical conditions, and functional status. Examination, hand grip strength and gait speed assessment gives insight into frailty. Sarcopenia and clinical features of malnutrition tells about the frailty of the patient. Frailty scores. Clinical frailty scores gives a visual assessment from very fit to very frail. Cognitive assessment tools that can be used are MMSE and CAM-ICU score. Biochemical assessment like albumin and CRP. Multidisciplinary assessment involving physiotherapist, occupational therapist, dietitian, and nutritionist can give you assessment of patient's frailty. So what are the limitations of using scoring system in ICU? Assessment of frailty in general. What are the limitations of using scoring system for the assessment of frailty in general? There may only be limited information regarding the baseline function. And number two, the clinical features of frailty may be exaggerated by the critical illness. And number three, frailty may be absent on admission but can then develop during the ICU stay. What are the limitations to assessment using frailty score? So there may be no time to use a comprehensive scoring scale. Number two, the use of such scales require training. Number three, they are validated only among stable community outpatients. And number four, their reliability is poorly studied. Next question. What is the utility of frailty scores? It provides comprehensive assessment of patients' vulnerability and overall health. Number one, risk stratification. It assists healthcare professionals in identifying individuals who are at higher risk for adverse effects, complications, and mortality. Number two, it helps healthcare professionals in planning, decision making about how intensely to treat a patient. Example, putting in invasive lines. Number three, prognostication. It provides healthcare professional and family with information regarding likely trajectory of the patient's health and helps them in making realistic decisions and goals of care. Number four, resource allocation. In resource-poor environment, frailty scores can be used to allocate resources optimally. Number five, communication with family. Frailty scores provide with an objective assessment that can be used to communicate with the family. Number six, continuous monitoring. Allows for continuous monitoring and tailored care plans according to the evolving situation of the patient.